have a picture.
Well, we have some pictures now of breasts like Leslie's, right?
Right, this is not Leslie. It's an example of what happens after multiple births and also after weight loss, where there is a drooping of the breast as well as flattening. And many women who are older have this condition, and they usually come in and we can do a breast lift to bring the nipple up to the proper position and also give the fullness by placing an implant.
What kind of materials will you be using?
Well, if you will do, in a case like Leslie's, for example, where you would do a skin tightening procedure as well as a nipple lift, you will have an incision underneath the breast.
That's for an uplift.
For an uplift. So I'm using the same incision, and at that point I can use a silicone-type implant, which is just inserted.
The word silicone scares a lot of people.
That's right.
So you said silicone-like. This is not silicone?
No, this is a silicone, but it is semi-solid. You know, it is liquidy, and it is in an envelope, so it does not leak. And you put this in under the muscle. You do not put it under the breast tissue. It's very important, because if you put it under the muscle, it maintains its firmness, because the muscle does not droop, and the muscle stays on top of the implant. So even if you get the hardening that everybody worries about, the hardening after an implant, because you have the muscle over it, you really don't feel it, even if you should get it. So the incidence of the hardening that people always talk about and know about is really down.
Plus, it does not interfere with any breast cancer detection test that you may want to take afterwards.
Good. Well, let me ask you one thing.
Breastfeeding, though.
No,
It has nothing to do with it.
Go ahead,
Nothing
Jill.
to do with it?
Right.
It has nothing to do with breastfeeding. You don't have to wear a bra if you don't want to. Your breasts will never sag. They'll never, you don't have to worry about breastfeeding or breast cancer.
Can I just get it straight? The breast is on top of the breast muscle, and now you're going to put that under the breast muscle. So that pushes out the whole breast.
Now if you have a rib cage, then you have the pecs that everybody, when they exercise, they get pecs. On top of the pecs, you have breast tissue, and then you have your skin, and the nipple areola.
Okay, where's that going to go? Under the muscle?
Under the muscle.
So that pushes out the whole...
The muscle and the breast. It does not go under the breast. So the muscle still stays attached, and the muscle is the bra. So you do not really feel that hardening as much, and the muscle by movement massages it, and it maintains the softness, and it does not pull the skin of the breast down, so you should get, with the heaviness, more droop.
Right.
So it's a good method to do, but that's only done in case like Leslie's, where you would have, or in cases of women who have a breast droop and atrophy or loss of breast tissue.
And that's what Leslie's problem is, and that's how she's going to correct it. Now, in a moment, we'll come back and we'll talk about Jill and find out what her problem is and how we're going to solve that, too. Okay, right back in just a minute. We're back now with our segment on breast augmentation. We have gotten up to Jill Herzog, and we're going to find out what it is that she'd like done.
Well, I'm going to go up 2 bra sizes. I've decided to do this because I've lived with this all my life, and every year when I go on vacation, when I get home from vacation, I always see the pictures, and I have a beautiful body, except there's not much happening up here to offset my beautiful shape down here.
I see.
So now
but you are beautiful. Even you will agree to that. Yes.
Well, she likes the way she looks, except for that.
And she's trying to improve it, and there's nothing wrong in that.
Right.
Yes.
So now I want to get rid of the ruffle top bathing suits. I want to be able to wear off-the-shoulder dresses and be able to show off a little
Oh, good for you. All right.
Is that the right reason, doctor? I mean, I know you give a psychological study.
Right. You know, when a patient comes in for any reason, for any surgery, you want to know, are they realistic? What do they really want? Do they know what they can achieve? And are they mature enough about it? Both Leslie and Jill are great because they know exactly what they want and they're doing it for themselves.
Yeah, I admire people like that who know exactly what they want and they're not afraid to go out and get it. Now, let's take a look at Jill's breasts, and this is what they look like. And next week, when she comes back, we'll show you the after pictures, but that's... You look okay to me, Jill. You don't mind the personal observation. You look
People
fine.
think so, but
Well, you know,
Most people think so? Jill's an interesting woman.
We're talking about balance, though. You know,
Right.
if a woman's hips are a little bit wider, then more on top makes you feel a little bit more,
That's right.
what's the word,
I wanna
in
have
proportion.
Right, a more in proportion figure.
All right. Well, what are the dangers? Certainly there's got to be some.
okay, let me just tell you, in Jill's case, what the implant that she's going to have, I go through the armpit, so there are no scars on the chest, because she doesn't need an uplift. She's perfectly fine. All she needs is volume. I go under the armpit, leaves no scars. It's a small incision, and I put in an empty bag, which I fill in while it's already in. So the incision is very, very small.
What do you
push
fill it
in.
with?
With saline water, salt water.
Salt water, which is natural in your body.
Which is natural in your body. So should it leak, should there be a big impact or whatever, it's water. You can just take the bag out and put another one in with
What are the chances
saline.
of that happening?
High collision accidents, a penetrating injury to the chest, has to be a high speed.
It won't just all of a sudden one day go flat?
Well, again, it could, because these are all factory made.
Yeah.
And if the valve in it is not sealed correctly, which we always test in the operating room, but if the seal goes, you could deflate. And then you come in and you just take it out and put another one in.
She's a young girl here. I mean, she's in her 20s. Is this really
That's
going to
right.
last for the rest of her life?
Why not?
And if it doesn't, I'll go back and see the doctor.
Okay.
There should be no reason, but again, it goes under the muscle, through the armpit. There are no scars on the chest. I do not like going through the nipple areola because I don't like going through the breast tissue. I
And
don't.
also for sensitivity, I would think.
Right.
there's a
I
chance.
just don't like, because if you get a scar that's hypersensitive around the nipple areola, it's very bad. I don't like scars under the breast because they may show. So
Yeah, an
unless-
armpit scar, nobody cares about.
Nobody cares.
How much does this cost, we should ask?
It depends with you having just an uplift plus a implant, or just an implant. So it goes anywhere from $3,500, $4,000, some places to $5,000. Depends on where you go to have it done.
All right, now, we have some before and after pictures, Jill, and this is what could happen to you, and we hope it does. There is that the before or the after?
That's the before.
You can't tell anymore.
That's the before.
That's
This
the
is
before.
a before on a
Okay.
lady who had the saline implant done through the armpit.
Right.
There are no scars anywhere on the chest, and it's mainly under the armpit. You never see it. It's within the armpit area.
Do you put the patient to sleep, or is it done locally, or?
I like to put the patient to sleep. I think it'd be very uncomfortable to have it done under local. Because
So you're hospitalized?
You come in the morning, you have it done, and you go home the same day.
All right. Now, that was the after picture? That was the after picture. Okay, so is that good enough for your beautiful hips?
That'd be perfect.
Okay. All right, so we're all set now. You're going to have this operation done when?
I go Thursday, St. Patrick's Day.
And I go on Monday,
On next Monday?
this coming Monday.
This coming Monday.
So I'll be 2 days before we come back.
Wow, that's going to be quick, but we'll see you here next Wednesday.
Wednesday.
All right?
Great.
All right, very good, doctor. Good luck. Thank you very much for being here. Jill, good luck.
All the best.
Nice to have you on the show. We'll be back in just a moment.